Hey everybody, we're just starting the nightly rolling video. So if you want to join me, and I'm sure that's why you're here, just grab your roller. If you've got a foam roller, that works perfect. So any roller you have will work. If you're typically looking at someone rolling, or you've seen it before, you'll see various different ones, and the regular old foam ones are typical. That's not what I've got here. This is an EVA foam one, so it's a middle density foam roller. But if you're just starting off, I would use the regular foam roller, the softest one you can find, probably the best to start with. And I'll touch on more on that in a little bit. But anyway, what we're going to do, we're just sitting on it first on our bum, and sometimes sitting here is difficult. So if you need to have your hands back and this is too far of a reach or a stretch, you could always put a bench, a step bench, or even if you're in your house, you can go up next to the stairs and put your hands on the first step. Sometimes that's a little bit easier, but we're starting on the right side, and I'm just kind of leaning on that glute a little bit. So I'm not straight where both glutes are on. I'm just leaning over to the one side. So leg is down straight, and I'm just going to roll back and forth, just kind of rolling from the bottom of the glute on up to the top. As you can see, I'm kind of laying back a little bit. And all you're doing, the whole rolling process, you're basically just searching for the tightness. So if there's some tight spots, or say you've got a knot, or the muscle's really sore from a workout, you'll know as you start rolling through that muscle what part of the tissue is actually either fatigued, sore, or you've got some needed attention. And if you're feeling something and it's a little bit uncomfortable, it just needs more attention, that's all. Okay, so I'm gonna actually go right down onto my elbow right here, and I'm rolling up towards the top portion of the glute. So it's just before you hit your pelvis. Yeah, you should be on that top section of the glute. Ooh, I'm feeling that a bit. You just want to continue to breathe and be relaxed as much as possible, even when you really start to feel a sensitive area. You just want to breathe, relaxed. So we're working on that top section of the glute. Lots of time, that's where the piriformis, you're going to feel a bit of the piriformis tightness, maybe from sitting. And we'll get into that a little bit deeper shortly. But first thing we're going to do now is we're just going to bring that leg up. So I'm bringing the knee up and then extending it out straight. So I'm just rolling back and forth a little bit on there to see if there's any extra little tight spots. There's one, so I'm going to bring that leg up. So right through that tight area. It's pretty sore right there. Usually when you bring your knee in close, you're going to feel that a little bit more. So it's going to intensify as you bring that leg up. Again though, if you're not, you're not really feeling anything in the glutes, then maybe those tissues are supple enough, and the rolling, you just might not have to do much to it. That's okay. All right, so again, back into the seated position. Now I'm going to bring the ankle up to the opposite knee. And this is typically the same piriformis stretch, or similar to doing pigeon pose, a yoga pose, to really target the glute. And then again, I'm just rolling back and forth. There's multiple ways of using the roller. Right now we're just kind of going up and down the length of the muscle, even though this is a real targeted spot here. And then I'm slightly going to roll from side to side just to see if there's anything that changes, or it's just a different type of massage actually on that tissue. Sometimes when people are doing this, I see them and they're kind of really laying back, or they can't get their knee up as high, which is fine. But over time, what I want you to try to do is try to get to this much more upright position. Again, like I said, if you have to have a yoga block under your hands, or a bench, or a step, that works to bring you up a little bit higher. All right, so that one feels really good to me. Okay, so I'm going to move on to the next side. And as rolling really is a personal movement. So in terms of, it really depends on what you feel. What are you experiencing? Are you really, really sore? Are you really, really tight? Do those muscles need a lot more attention? Do they need a lot more self-massage? Maybe your muscles aren't, tend not to be very sore or tight at all. And you might not find a lot of, benefit or use for rolling. It just might seem like, oh, why would I spend so much time doing that? So it really depends on where you're starting from. As I was talking to a client earlier today, though, the other benefits that rolling and some stretching, just some self-myofascial release, so ball work, that can really aid in your recovery process in terms of your workouts, recovery from an injury, and just maybe the stress load that you carry in the muscle or the tissue. Okay, so I'm going to go down to my elbow again. So I'm laying back a little bit more. So my waist or my hip bone is about right there in my back. Just going to the top section. If you roll onto the hip bone, it's not going to feel good. You can feel it right. For me, it's right there. And yeah, it's not going to feel very good because that's a bony area. But you'll know where you're at. You want to start on that top section of the glute and see how the tissue's actually doing. So this is my typical nightly routine in terms of a rolling kind of order of how I go through it. It's not a complete rolling circuit, so you can follow along and adopt certain areas of the body that you want to, and it really just depends on what areas you need more attention on. I find that with low back injuries, so I'm going to bring the knee up, or the ankle up to my knee. Kaylin, can you clear that off the screen, please? Thank you. Sorry about that, everybody. Hopefully that didn't, it was just a file page from a video, but hopefully that didn't kind of show up on the recording. Anyway, back to the rolling. So I'm on the glute, ankle and knee are together. you're following along, you're going up and down or back and forth a little bit, trying to find the tightness. And really when you're in this position, you're just looking for the piriformis tightness. Maybe in the glute medius and minimus, a little bit in the glute max. You know, if you do some lunges, squats, sure you're gonna feel this too. But I think more so if you're down lower, working through the glute, you're gonna get more effect just doing this type of rolling on the glute if it's from a soreness after a workout. All right, so we're gonna move on, going on to the hamstrings next. So with the hamstrings, when you're on there, going back and forth like so, again, I use this just as a gauge, like, okay, how are they doing? Where is it sore? I can feel, so I'm doing this, I feel a little bit on the inner thigh, more so I think on this left leg. And because one leg or two legs on there, just not enough pressure, I scooch the roller over so it's just on the one leg. Turn, you can see this a little bit better. And then I'm just rolling back and forth. I'm kind of internally rotating that leg, go up towards the glute, just to get the inner thigh on there as well. So that's a tight spot for me right here. Ooh, there's a, yeah, that one. Ooh, that's sore from the deadlifts and leg curls yesterday. All right, so back and forth a bit on there. So I'm going to switch legs, going to the other side. Yeah, definitely feeling the workout from yesterday. This morning I didn't get my rolling in with the massage balls. I slept in a little bit. And so typically I can really notice difference if I don't do that. One thing I do find, the more you roll, or more I've rolled and done kind of the whole series of how to actually become more mobile, increase flexibility and restore some proper muscle function, I guess, range of motion, and just better movement. Once you see those improvements, it's very typical to stop doing some of the things that led you to that. And so all of a sudden you start to regain some tightness, and you're reminded, oh, I got to keep doing some of those things. So a consistent action or effort is the best approach. Okay, so we're moving on to the quads. So I'm just on one quad instead of doing two. Personally, I know I just get a little bit more effective experience if I'm just on the one. You can do both at the same time. It's kind of like the hamstrings though. If you're on the one leg, you get a little bit more pressure. And then of course, if I'm rolling out to the side, it's going to require me to be on the one leg. Careful when you go too far onto the side though. You can put a little bit too much pressure maybe on the IT band. Some people roll right on the IT band. It's not necessarily the most beneficial thing to do for your IT band. I would suggest not rolling the IT band. If you've got some IT band tightness, there's a better approach to relieving that. So I don't know if you can tell, but on this, I'm on the left leg, and my right knee is on the roller as well. Just using it to take up some of the pressure because I can really feel this on my left leg. Okay, so now I'm going to roll down, or I'm going to slide down on the roller till I'm on the top portion of the quad. And there's a little muscle in there called your TFL. And it attaches on the upper portion of the pelvis, your iliac crest, and then into the upper third of the IT band. So it feels a little bit sensitive when you're on the top portion of the quad because you might be rolling onto the tendons, and sometimes it's hard to know whether or not that you're feeling some tendon soreness, or is it something that you're feeling right in the muscle belly? Because these two, the TFL and your upper part of your quads, kind of intermix. But for most people, that's going to be a little sensitive area. So I'm going to roll back to the opposite quad and do the same area. So it's that top portion of the quad. Interestingly enough, I think with the change in running pattern, just with the added snow, I can really feel this around the hips. I think just because the change in how I was running, it's a little bit more active when you're running on the snow or through the snow, and on the ice you're picking up your legs, you're pawing at the ground, so the muscles feel a little bit slightly different. Yeah. Whew. That's so sore on that side. Okay, that's about enough. All right. I'm feeling it a lot, but more is not necessarily better. More often is better. Okay. All right, so I'm on the roller, just on my knees, and I'm going to go on to the shins. So I'm just going to take it easy on the shins, though. So I'm going to roll forward, and then just rolling back, just a couple of times. Try not to overdo it on the shin. Good, and just one more here. All right, just to work through the anterior tibialis. Okay, so now we're going to move on to the calves. And so sitting up on my bum, leaning back in the hands, just got the calves on there, doesn't really matter where. And I'm just going side to side a little bit. And then I'll slowly work up the calf, down the calf, and see what I find. I definitely know that they're sore. Did a run a couple hours ago, and my left calf was telling me it needed some stretching and some attention. So it's funny though, I felt it in the night when I was sleeping. It almost felt like that calf was gonna cramp up. So right when I started the run, I could feel it. Yeah, it's right there. Yeah. Okay, so it's side to side. I'm just going to go forward and back. Just lifted my bum off the ground and rolling lengthwise up and down the muscle. At night, I'm often not sitting. I'm often just laying down with my calves on the roller. It's a little bit more of a restful position. But if you're a little bit more active in the rolling, holding yourself up, you're going to feel the other muscles working just to support you. And if you want the real relaxation effect, then I'd suggest just laying back. And I'll do that in a moment. But I just got to work this out because They are a little bit tight and sore today. So you can always put one leg on top of the other one as well. Ooh, it's a little bit more pressure, especially if you lift your body off the ground. That's too much for me. All right, so I'm just gonna move it down towards the Achilles a little. It's not bad. So the reason I'm saying it's not bad is I kind of know what it's like when certain areas are too tight, too sensitive, and I know what to look for. So if you're just starting, then you know what? You might feel a lot of sensitive areas, or you might not feel much. Sometimes if you feel like you've got a knot or something that's really, really painful, I suggest just holding it there in that position, right on it. And then just sit here and hang out. Just wait for the muscle to slowly release. And it'll happen. It just takes some time. Whether you're on there for 5-10 seconds or if you're on there for 2 minutes, a little bit every day is helpful. Okay, so calves. If you are laying down, you know, grab yourself a pillow, put behind your head. You can just lay here. Just relax. Roll the legs from side to side. Kind of bring it up the calf a bit. You'll know if you really need to be rolling a muscle out. It's kind of like that. You need that massage. Say you did a hard workout of a certain muscle group, and then the next morning it's like, ooh, it's really sensitive, kind of sore, even sore to touch maybe. I implore you to jump down on the ground, grab your roller, and put that sore muscle right on the roller. You'll know exactly what that soreness is that I'm referring to. And right at that moment may not be the best time to roll, but I'd wait a little bit, you know, give it 12-24 hours on that sore area and then roll it out a little bit more. All right, there we go. Okay, so one more I'm gonna do. I'm just gonna bring it up to my back. So laying on there. So if you're laying on here, your shoulder blades should be just above the roller. Okay. So feet are flat, bum is on the ground, shoulder blades are just on the upper portion of the roller, and then arms are overhead. I'm just gonna let my head rest back, and just letting the arch happen naturally. I'm just gonna lift back up. Support the head if you need to, or the neck. Just a short little break on that one, and then we'll do one more. Okay, leaning back. Just getting a stretch through the thoracic spine. Good, coming back up. All right, okay. So in terms of the roller, that's about it. And then I'm gonna move on to using the massage ball. There are other areas that you can roll. You know, you can roll your lats, maybe the upper back even a bit, or the traps. And I'll save that for another video. We're gonna move on to using the little massage balls, which are right here. Okay, so the different massage balls or self-myofascial release balls. This is a racket ball, and this is actually a yoga tune-up ball. You can order these online if you need that link. I can post that below this if you're looking for these. These are great. They're the right pressure or the right squishiness or firmness. There's multiple different sizes, and I've got all three, so if you're interested, I will be making other videos to show that as well. And once in a while I post a link of the tune-up rolling videos. So, check one of those out too. But anyway, we're taking this ball, and what we're going to do is we're going to work on the lower back to mid back region. Okay, so if you're wondering where to actually place the ball to start, so if your pelvis, the bony part of my pelvis is right here, I don't want to put the ball right on it. I'm going to move just above, and then we're just to the outside, or right along the muscular part of your spine. Okay, so the spine's in the middle, and then you've got your erector spinae musculature that we're going to go up. We're going to work this whole area, and then we're going to come out onto the side here, and we're going to kind of go back and forth and up into about where the lower ribs are, and then we'll just work our way through that whole portion of the back. Okay. All right, so just laying down and taking the ball, and I'll start with it just above. So yeah, there we go. All right. So when you've got the ball there, your feet are flat on the floor, you bump off the floor, you can kind of do what's like a little waggle. So you're moving your hips from side to side. You're just kind of rolling back and forth, similar to using the foam roller. And I'm just moving side to side a little bit. So I'm being fairly gentle, not too much pressure just to start. So I'm just trying to figure out where the tight spots are. And my other hand is close to the ball, so I can make little adjustments and move the ball just a small area. So I kind of started from the outside, and I worked in towards the spine. Now I'm moving back out to the outside again, and I'm in an area just above the pelvis, just below the lower rib. And then what I'm doing right now is I'm just rolling my body onto the ball a bit more. So my weight of my body is putting pressure on that area. And sometimes that section of your back, just outside of the spine, between the pelvis and your lower rib, that's called your quadratus lumborum, or the QL. And that can get pretty sensitive in there. If you've got some sort of back issue, lower back pain, you'll get some muscle guarding going on, and so there's kind of a low grade contact in those muscles. And the muscle guarding, it can occur in the QL, as well as the top of the glute, in the glutes. And those muscles are really trying to support your low back. And when you're feeling some low back pain, those muscles kind of stay constantly engaged. All right. So yeah, I'm just going back and forth. It's feeling fairly good for me personally, so I'm moving on. I'm going to reach into the opposite arm. And again, I'm keeping my bum up off the ground so I can just adjust the pressure as needed on the ball. And now I'm working on the muscles that are running right along the side of the spine. And I'm just kind of rolling over it back and forth. And each time I adjust, I'm moving the ball slightly higher or up towards my shoulder blades. So it's still in the low back. I'm going to work towards that mid back area. And right there, I found something that's kind of tight. Yep. So I'm just going to hold that a little bit. Sometimes a really sensitive spot it can take some time for that to go away. I find if I roll, if there's real sensitive or sore areas, if I roll it in the evening and then a little bit the next morning or that next day, doing that 2 days in a row, it pretty much takes care of it. And it kind of restores my normal movement and function. So you might ask, why am I spending so much time just in this area of the back with the foam roller and these little balls? It's really because so many people suffer from low back pain. I'm one of those, and I have found after my own back injury, this is a great way to manage that pain and to manage my ability to continue on with the exercises or the way that I want to exercise. All right, so that side is done, and I'm moving on to the opposite side. I know it's hard to see what's happening. The camera was below the floor, and the floor was like a glass, you know, it was a piece of glass. You could actually see what's going on. So I do have a video of that. I can actually post that in case you're wondering what this actually looks like. I'll also do a close-up video so that you can actually see what's actually happening here. So I'm on the outside again, right towards that QL area. It's pretty sensitive. If you're not used to using these balls, then sometimes the pressure of the ball, it's gonna leave you a little sore. Like you might feel that the next day, just in the area, the skin, the tissue. It's just gonna be too sensitive, and maybe even a little bit too sensitive to touch. So that's okay. It shouldn't be like that always. But as you start rolling, that's why I say use the softer foam roller and balls first, and then move on to firmer. You want to adjust that as your body adapts. I see too many people using the firm rollers or even the lacrosse ball, and it's not necessarily the best thing. You're trying to actually let the tension out of those muscles or the tissue, and you're trying to let that muscle relax on its own. You're trying to realign the muscle fibers. If there's knots in there, you're trying to work those out. So sometimes the more pressure, feeling like, oh yeah, more is better, firmer is better, like that's not necessarily the case. I'd say more of the right attention is what someone's looking for. All right, so moving right up into the mid back, and yeah, it feels fine. Feels fine. All right, so where are we at time-wise? Okay, I think this is about it. So you don't want to spend all night here on the ground. Yeah, that's it. All right, so a little bit of a foam rolling class for you and myofascial release ball class for you. So if you have any questions, please post them below in the comments, and we will answer them. And if there's any other videos that you'd like to see, just let us know. I'll also be making other videos of the other areas so that you can follow along in those as well. But I want to keep these short or short enough so that you just gain something, gain a little knowledge, follow along, do what you need to do, and then move on to the next day. Okay, awesome. All right, hope you guys are having a great night or day whenever you watch this, and we'll see you later.